Hello listeners, welcome to Views on Health. On the program tonight, we have with us Professor Eranga Wijewickrema, Professor in the Department of Clinical Medicine, Faculty of Medicine, University of Colombo. And Professor Eranga Wijewickrema is also the President of the Sri Lanka Society of Nephrologists. And also we have on the program tonight Dr. Anura Hewageegana, Consultant Nephrologist at the National Institute of Kidney Diseases in Colombo. And Dr. Hewageegana is also a past president of the Sri Lanka Society of Nephrologists. I'm sure listeners will recall that we had both these esteemed professionals on the program last week speaking on how to protect your kidneys and focusing on World Kidney Day, which was marked on the 14th of March. A follow-up to that is the program tonight focusing on advice to kidney patients. Yes, there are so many kidney patients out there across the length and breadth of Sri Lanka, and let's hope that this message or the messages and the words of advice will reach them far and wide. So without any further ado, welcome back again, Professor and Doctor, and may I ask you how you would tell the patients out there how best to take care of their kidneys. At the same time, I would like to know how bad is the situation in Sri Lanka as far as kidney disease is concerned.
So essentially, I think we touched upon this last week also. There are different types of kidney diseases. There are acute type where the kidneys can get damaged or their function can get affected, and then these acute type of kidney diseases can be cured, so they can be back to normal. But the main issue is the chronic kidney disease. This is a chronic type of disease where the kidney function becomes affected irreversibly, and then it's a progressive disease, and eventually the kidney function comes to to a very low level, and then they end up on dialysis or they require a kidney transplant. So this is called chronic kidney disease. So if you want to focus on that particular condition, generally in Sri Lanka the prevalence is about 10 to 15%. So it's quite high.
Could you differentiate between acute and chronic?
Acute kidney disease is a transient illness due to a reversible cause, and if you identify the cause, you can reverse it, and most likely you can regain the kidney function to the maximum, or totally you can restore the function. There may be a functional impairment in certain cases only, but most acute kidney injuries in their trajectory will lead to a chronic kidney disease later. So these are mostly reversible causes. Now, when it comes to chronic kidney disease, it is relentlessly progressive, irreversible, progresses to end stages, the grave stages where you require dialysis and kidney transplantation. There you just don't have a permanent cure, but you can still have a positive treatment just to manage the risk factors and retard the progression and prevent the function being damaged for a considerable period of time, with good rapport of the patient, good adherence to drugs and medical advice given by the treating consultant.
The professor said the last time around that the causes, like it could be genetic, and then of course leads to from NCDs as well and other diseases, the risk factors that bring on kidney diseases. So it goes back to the fact that it's across the board. And you said there were more males than females affected, and where children are concerned, it is of course genetic. Now when you take again acute, can it be because of genetic factor that a child has got kidney disease? At that stage, is it could be reversible?
Well, the genetic causes, obviously the genetic abnormality cannot be corrected, but that doesn't mean that even if you have a genetic problem, the disease manifests early. Sometimes you can have a genetic problem where the person can be okay during childhood, or in early adulthood, and because of some other trigger, they can get the disease later on. So obviously, genetic doesn't mean that you are not having any way of controlling the disease. There are ways to control the disease, but it depends on the disease itself. But I think the main focus that we want to highlight is people, when you consider chronic kidney disease, which is the main focus of discussion today, is that chronic kidney, when somebody has chronic disease, as Dr. Hewageegana mentioned, that it is a relentlessly progressive condition. But having said that, there are ways to kind of delay the progression. So the main way, there are two main methods of doing that. One thing is, for example, if you have your kidney disease as a result of diabetes or hypertension, you need to meticulously control those risk factors. So make sure your blood sugar control is kept at an optimal level. And of course, if you have high blood pressure, you have to make sure that the blood pressure is under control. You have to adhere to lifestyle modifications. Then make sure that you take your blood pressure medications appropriately. Make sure you check your blood pressure and make sure it's kept at a particular level. So all these are they are to make sure that your progression is kept to a low rate as possible. Then in addition to that, there are additional things you have to do to minimize the progression. This is also some of them we discussed last week also. You have to prevent or avoid exposure to certain toxic substances, like for example over-the-counter medications such as non-steroidal anti-inflammatory drugs, painkillers, and certain antibiotics. So indiscriminately taking these drugs without any medical advice can damage. And in addition to that, exposing themselves to certain other nephrotoxic substances, all these you can avoid. So these are the two ways you can protect your kidneys from, in a sense, like to delay the progression.
Yeah, an addendum to what Professor Eranga has said about the genetic diseases. Like most of them will manifest early in life, but some, like monogenic proteinuric kidney diseases, will have their effect in the middle age or later middle age. And certain cystic diseases like polycystic kidneys and so on, the genetic defect is there, but still the disease manifestation will be after the middle age. So it does not mean that by being genetic causes that it always happens in the childhood. That is one thing. And about the about the treatment, as Professor Eranga said, you need to just treat all the risk factors, especially the diabetes and hypertension, to optimal targets and maintain those targets with medication and lifestyle modifications.
So you say 10 to 15% of the population is affected. That's a very large number. Do you see it increasing because of the increase in diabetics and patients with other NCDs? Yeah,
you have to be. When it comes to chronic kidney disease, it's a spectrum. As we discussed last week, it can be very early. Somebody can have chronic kidney disease at a very early stage. And then you have the terminal stage where you need dialysis and transplant. So when I say prevalence is 10 to 15%, it involves the entire spectrum. So then answering the second question, the main reason why this chronic kidney disease is prevalent in Sri Lanka is the non-communicable diseases. These are the main risk factors, diabetes and hypertension. And they are also increasing in prevalence. 1 in 3 adults in the Western province is having diabetes. And 1 in almost 2 individuals are having hypertension. So likewise, so these risk factors are also becoming more and more prevalent. So that's the reason for the increase in chronic kidney disease.
So how much can you tell the general public? You can tell them, but it's up to them to take it to heart and to make sure that their health is given priority. But whether it happens or not is moot. So what else can you do to emphasize? We from the media are ready to help you to disseminate information of this sort, your advice to the general public. The public has to respond. You have to meet halfway. But if it doesn't happen, And I don't see it happening, my own personal view, which is why today you have so many patients to see. I'm not being critical here of my fellow Sri Lankans, but it is important for us to take note of this. So could you just draw the attention of our listening audience right now to the importance of taking care of their kidneys?
Yeah, I think before I hand over to my colleague, one of the key things is I think public generally, people with kidney disease are not happy with the care they are getting, because it's a disease. It's basically they are doomed when they hear the word chronic kidney disease, because naturally the word itself means that it's a relentlessly progressive, irreversible kidney disease, eventually leading to end stage where you need dialysis and transplantation. So it's a very worrying news for somebody who to hear this. And then what happens is they realize that in Western medicine specifically, that treatments that we offer, they don't stop the progression. So they don't. So we can't say these drugs are going to get your kidneys back to your normal previous level. So that is something that is I know. So this is what we have. So we can't go away from that fact. But having said that, we can offer so many things to delay the progression, as we discussed earlier. And then obviously that's not good enough for most. And then they end up, with so many other types of treatment. So that's another important thing that I thought we need to highlight. There are different types of other treatments available in this country and similar in other parts of the world. So it's when they run out of options, people resort to these other modalities of treatment. It's very, as a Western practitioner, I can't comment on the effectiveness of the treatment, but we can comment by by observing things that we see, because some of these patients go to these other treatment methods and then they come back pretty ill, and they have lost their time, also. Now, for example, when we say, for example, a person with advanced kidney disease needing to prepare for dialysis and transplant, they go to some sort of other treatment and they lose this valuable time to get prepared, and they come with the terminal stage, and we don't, and very ill, and some people die. So that's an important message we want to highlight. Just don't. Although this is a bad disease, that doesn't mean that there's nothing to offer in Western medicine. We offer, we make sure first we try to protect or delay the progression, and then at the point when we get to the stage where you need some form of dialysis or transplant, we make you ready for that. And people do well even with dialysis, and even transplant makes you back to your normal, usual self. So the important message is for people to have faith and belief in your doctors, consult, kidney doctors, and come to them and make sure that follow their instructions rather than trying to go to unknown, treatments. Anura?
Yep. So these, as he very correctly said, the contemporary methods people resort to for quick reliefs and so on. So there is a undue kind of prominence and emphasis given to them by certain people. I don't call them quacks, but it's not my right to, ethically I have no grounds to say so. But as he very correctly said, we have observed people going for contemporary other medications, medical treatments, and having lost valuable time for their preparations due for dialysis and transplantation, and various medications that they give, having heavy metals and certain toxins. Certain decoctions will have certain minerals like potassium, which is which should not be given to patients with kidney diseases and so on. Now, by nature, by definition, this disease is a chronic disease. So it's affecting a vital organ. Now, if it is irreversible, by science, by evidence, we have proven that it is not reversible. So, when people not having enough faith and enough confidence in their treatment is not acceptable whatsoever. So, it's a disease where the vital organ is being damaged chronically. So, in the first stage, if they have just come early, what we do is to prevent and retard the progression of the disease. So, when it comes to, we can't hold the disease. We can regress, we can't regress, we can retard the progression only. So when it comes to end stage where you just need a replacement, at one stage you need a replacement. That is the stage where we call that he needs a renal replacement therapy, kidney replacement. The replacement is by two means, by giving dialysis, a modality of dialysis, and if the patient is suitable for a kidney transplant, the best available viable option is to give a transplant. So that is science. So people have to accept that.
That's very important. Thank you so much, Doctor, because I know of a particular case where the patient did go to an alternative form of treatment. It didn't work, lasted about 4 to 5 months, and then came back. But fortunately, he did have the transplant and he lived a good period of time. So I think this is good advice to our listeners out there that you get your priorities right where this is concerned and decide what you need to do. And I think it's a waste of your time as well, isn't it? Your time, your resources. You're treating somebody, then they go away, they come back. I think, I don't know, medically, maybe you have to start all over again. So it's a lot of vital resources and your valuable time has been lost in the process. As far as advice is concerned, if it comes to a transplant, what is the process that they have to go through? That now the patient has been with you and he or she has been told this is what you need to do. Now they're ready for the transplant, mentally ready to go through with it. What is the process, the best process that they can follow to get a donor to get the transplant
So
done?
there are different types of transplants. So basically there are broadly two categories where there's a living donor transplants where somebody who's a healthy person who has good functioning kidneys will donate one of the kidneys to a person or a patient. Then there is another type of transplant called disease donor transplant, where somebody who's dead or who's dying. So the term death is a very kind of not a very literary mean dead. Some people are on the ventilator, they are brain dead. So in those patients also there are no chance of recovery. Then we take their kidneys and transplant them to patients. So these are the two broad categories. So in Sri Lanka, the main way of transplanting is living donor transplants. So basically, so that's the main type. And getting back to who can get transplanted, patients who are fairly, who are kind of physically fit. Generally there's no age limit, so anybody who's healthy in the sense like apart from their kidney disease, if their cardiac function is good, and especially if they don't have any kind of infections, chronic infections or any form of cancers which sometimes might bar them from getting transplants, then so most of them are actually suitable to undergo kidney transplants. The main barrier is probably finding a suitable donor. So, but there again in Sri Lanka, being where there's so many people who are very altruistic, who wants to donate. So therefore, living kidney donation is actually in the entire region of South Asian region. We are having the highest number of kidney transplants per million population. So we are doing quite well in that front.
Thank you. That's wonderful to hear, and I think very heartwarming to hear that. We have so many kind-hearted people out there who are willing to donate their kidneys. But there is a process, isn't there, Professor? In terms of, if you can explain, we heard of they need to match or blood types needs to match.
Yeah, so essentially these decisions have to be made by your own doctor. So basically it's your consultant nephrologist who has looked after you from the time that you've got the kidney disease. So they know, first thing is the timing, As Dr. Hewageegana said, we know after a certain time that the kidneys, this is it, this kidney is not going to recover, and that this kidney function is not enough to sustain a good life. So that is the time that the doctor will recommend that you have to go for a kidney transplant, kidney replacement, or dialysis. So obviously, when you consider the two, kidney transplant is the best option. So then there is a series of tests that you have to do to make sure that you're physically or biologically fit to undergo kidney transplant, because it's a surgery, so all these requirements have to be met. And then, of course, you need to find a suitable donor. And as you said, the essential criterion is a blood group match. So it has to match. So certain blood groups are compatible with the particular blood group. So that has to be, that is an essential criterion currently. But in other parts of the world, we do cross the the blood group barrier and do blood group mismatched donors as well. But in Sri Lanka, we haven't done so yet. So it's a blood group compatibility that matters first. And then, of course, there's a genetic match, which is called the HLA match. So that again has to be done, and where we have we have to have a certain percentage match to qualify to be a good kind of compatible pair.
So ideally it would be a family member as a preference, as against somebody outside of the family donating a kidney.
Now it all depends. Now if he's a blood blood relative, the matching would be better. So it all depends. Now even from the unknown public, sometimes there are good donors. Now the match is according to a genetic testing called HLA. So we match a certain percentage, and if it is optimal, the results are going to be very good in the future.
Having listened to your explanation on this, assuming that the surgery goes through successfully, and I'm sure it does in Sri Lanka. I personally know of cases where they have hale and hearty having undergone the transplant. It may not be a fair question, but I'm sure there is quality of life, and one can live for quite a number of years if he or she takes care of himself or herself. Can you comment on that, please?
Yeah, actually, transplantation is considered the best replacement method for kidney failure. Now, if you just take care of your kidneys, the half-life in the sense the life expectancy after transplantation, the kidney's life expectancy is 20 years plus.
So that augurs well. Any comments, Professor?
Yeah, so essentially, as Dr. Hewageegana mentioned correctly, it is the best form of treatment for people with end-stage kidney disease. So the other comparator is dialysis. So otherwise you'll have to end up on dialysis 2 to 3 times per week. And when you compare these two groups, not only the graft function, the life expectancy. So when you compare with people somebody on dialysis versus somebody who has had a transplant, the life expectancy basically doubles when you are having a transplant. So that's another important message that I have to give to the public.
Just one more question, but dialysis is a must at the initial stage before they go for the transplant?
Not really. In fact, that's the importance of getting followed up by your own doctor for a long period of time. So they will know when the kidney is going to fail. So before that time arrives, you can prepare and prepare for a transplant, and that is why we specifically emphasize on this lost time. If you go for these alternative forms of treatment, you lose that opportunity.
Thank you. What's your take-home message?
Yeah, first the prevention. Now when you have a disease, again you have lots of things to do. In the initial stages, again you can just prevent it being being progressed faster by controlling the risk factors. And as I said previously, and as Prof. Eranga said, to maintain the healthy lifestyle plus controlling the risk factors to targets will retard the progression. So when it comes to end stage or near end stage, according to your doctor's advice, to find the most suitable methods of kidney replacement, either by doing dialysis. People who are not suitable, there are a subset of people who are not suitable for a kidney transplantation due to a medical contraindication or patient's preference or whatever. So those people have to be on dialysis lifelong. But we always advise people who are suitable for transplants to go for a transplant without just waiting in the dialytic stage. So, I mean, if they are qualifying for a transplant, they should go for a transplant either by finding a live donor or by getting a deceased donor transplant. And after getting the transplant also, there are certain medications lifelong that you need to take, and medical advice periodically you have to take and maintain the kidney graft function.
Yeah, so the important thing is that I think I need to emphasize is that dialysis is not bad, for a person who needs replacement. Sometimes, as Dr. Hewageegana said, sometimes you're not suitable for a transplant, and also sometimes you don't get an opportunity to get a transplant. You need a donor to donate a kidney. So that might not happen quickly enough. So then you'll have to invariably be on dialysis. So some people are scared that being on dialysis is not good. I mean, it's not as good as a transplant, but again, people are scared that they might die when they are going on dialysis. That's a common myth that people have. So people on dialysis do die, but that's not because of dialysis, because of the disease itself. So they have so many other problems, diabetes, heart disease and things like that. So they should not be scared of dialysis. If it is necessary, they have to be ready to be on dialysis.
Thank you so much for your words of advice, and I'm sure our listeners will take note of what you have said on the program today. Thank you to you, Professor Eranga Wijewickrema, Professor in the Department of Clinical Medicine, Faculty of Medicine, University of Colombo, and the President of the Sri Lanka Society of Nephrologists, and you too, Dr. Anura Hewageegana, Consultant Nephrologist, National Institute of Kidney Diseases in Colombo, and also a past President of the Sri Lanka Society of Nephrologists, for being with us on the program, sharing a valuable insight and giving good advice to our kidney patients on how to take care of themselves. Thank you so much. My thanks also go to Inoka Gamage for technical assistance. Thank you, Inoka. I'm Fatima Razi Kader, bidding you good night and looking forward to your company next Monday, same time on Views on Health.